Hi everyone, this is Dr. Raquel Butler from Integrated Veterinary Therapeutics.
And Sophie Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Hi everyone, welcome to today's Equine Functional Posture podcast. We are discussing a topic that I'm fairly passionate about, joint injections. And so we're going to delve into lots of implications of them. So how are you today, Sophie?
I'm going very well. I'm excited because I have learnt so much from you about this topic, and it's going to be great that you share it with everybody that's listening.
Yeah, it's a really common practice these days to have horses' joints injected, especially if they're performing, to help them perform. Some horses are having it done on a very regular basis, and we really need to consider the welfare implications of this. I don't kind of throw around the word welfare that much, to be honest. I think we're all working to improve the horse's quality of life, and that's our aim in doing this podcast. But we do have to question when we're doing things like repeated injections, cortisone specifically, what are the welfare implications of that long term? And, when or is it even appropriate measures? And yeah, so it's, there's a lot to discuss, hey?
Absolutely. And it's going to be great. Just starting off, there's going to be quite a few people for which this episode is going to hold a lot of information. What is the aim of a joint injection?
Yeah, so generally they're aiming to reduce inflammation in the joint, improve the horse's comfort, and ultimately their function, improve potentially the joint range of motion. And it can also be a bit diagnostic as well. Like, for example, you've done maybe a joint block and a radiograph and shown that this joint appears to be the problem. But then how long the joint injection actually lasts and actually helps the horse and gives them relief can be a bit diagnostic to your ongoing management of the horse. But we do have to realize that in that aim, it's not in correcting or treating the underlying cause necessarily. We might get reduced inflammation and improved comfort, but that doesn't mean that the underlying cause of the problem has been healed. And that's an important thing to note, that when we start loading them up again, we're not on a healed joint necessarily.
Absolutely. And of course, if you're not correcting or treating that underlying cause, you can be in a situation where it's enabled you to continue performance or continue doing work where, we'll go much further into this down the track, but the rehab, the posture, and you being able to support your horse to improve their biomechanics and their motion from a structural perspective and a functional perspective can be the whole key that really makes a big difference.
Yeah, definitely.
And so, there's multiple kinds of joint injections. Do you want to take us through the kinds, the difference between high motion, low motion joints, etc.?
Yeah, so there's generally a couple of types of cortisone that can be utilized. Triamcinolone is a more medium activity duration, generally used in the higher motion joints, such as your stifle. And the reason it's a little bit safer in those high motion joints with the cartilage. In the low motion joints, they often use a more a stronger sort of cortisone. It's a bit more long acting, and they're not so worried about the cartilage. So if there is kind of fusion and stabilization of the joint, then it's not as much of an issue because it has less motion. And then there's betamethasone, which is a medium to long active. They use it in low and high motion joints. I mean, I generally now hear more about triamcinolone being utilized. But if your horse is having a cortisone injection, it would be good to know what type of cortisone has been injected and what kind of duration of activity they expect from it. Also going to be really important if you're competing, what your competition withdrawal times are. And the other thing to consider, which they should consider when they're deciding on the type of cortisone, is what is the health status of your horse. So if they have equine metabolic syndrome, that's right, isn't it? EMS?
Yep. Yep.
PPID, which is Cushing's, or laminitis, or even other underlying kind of health challenges, then you may need to reconsider this as an option because it's an added stress to the system, and it can really tip those horses over.
Absolutely. And, when you're talking about the kind of side effects that it can come, when you're talking about a horse who possibly has some health issues already coming up, what are some other risks of, injecting cortisone into joints?
Yeah, so one risk is that you can get a joint infection. So, I mean, the vets that are injecting these joints do it as cleanly as they possibly can. Like they should set the joint up in a sterile fashion as they can, utilize sterile techniques, gloves, and they're very specific about that, how that is done, but it doesn't rule out the potential for a joint infection. Some vets will inject antibiotic at the time as a prophylactic.
Which means kind of preventative. Yeah.
Yeah, so they're trying to just reduce their chance of joint infections. But yeah, that's something to be aware of. Another one is laminitis. So, some horses you do just have, like, they're very sensitive, and sometimes they've had, I would suspect they've probably had subclinical laminitis that's not been noted. Especially if your horse is shod, you might not notice that they've had subclinical laminitis for a very long time. And so giving them a cortisone injection can just tip them over the edge, and then all of a sudden you've got a full-blown laminitis attack, and sometimes they don't recover. You can get in that instance, you can get rotation happening really quickly. It's different to kind of your chronic laminitis where there's like an inflammatory process, but it's a bit slower in some of those. This is like an acute attack that can completely undo a horse. If they're getting kind of repeated cortisone exposure, it really stresses that cortisol hormonal axis, like the HPA axis, so the pituitary adrenal axis, and a lot of horses are under stress anyway, as much as we would like to say they're not. They are, they're under environmental stresses, performance stresses, nutritional stresses, and other kind of performance stresses. And so we add a substance like cortisol, which just kind of stresses that system again, and we can tip them over into Cushing's. And I've seen a number of these horses where they've had multiple injections over years, some a lot of injections, and they've ended up like in agony because of that in their later years.
That's definitely a strong consideration to make, over the course of a horse's lifespan and their well-being, especially when often people are doing this with the ultimate desire of bringing comfort to an area. So, that's a something that might not be considered as commonly. So, and of course, you can have a few other things pop up, a reduction in ligament health. So, inhibiting collagen production and repressing healing. So, There's also the effect on cartilage degeneration in the same way, with the cortisone inhibiting the matrix synthesis. You pointed out earlier the fact that it's not a joint regeneration technique. So it's about, the possibility that making other pathologies worse, like ligaments, cartilage damage, etc., that's why it's so important to be thinking from a biomechanical perspective. If you are going to capitalize on your joint injection that's being done, then you want to be setting yourself up with the best opportunity to make the most of the comfort that's been introduced from inhibiting, the pain or the
Motion.
yeah, that kind of, and then change what's causing that so that you can have a meaningful difference in movement and the effect on that joint over the long term. And of
Yeah.
course, you can also have injuries in other areas when you're masking. If you don't have a well-functioning system, so we often talk about the core, the pelvis, the whole system that supports you, particularly in a performance setting, like it's really necessary to be able to get around functionally. If you are masking, so if the underlying reason that you're having a joint issue is because your biomechanical system is not functioning optimally, and then you can mask the symptoms of that dysfunction using a joint injection, you are possibly setting yourself up to be in a not very safe position, both you and your horse, because it's a symptom of an underlying dysfunction that needs to be noticed and understood for what it is.
Yeah, and I think that's really why it's so important to have a good body worker in your corner so that you can be working with the rest of the body at the same time and like balancing out the biomechanical function. But, if you say your horse has an injection and then you get a good response with it, then the question then is, well, what do you do? Do you continue having repeated injections because you've seen this really good response, the horse is going so much better, you've noticed a huge improvement? But for some horses that doesn't continue to last. Every now and again you'll be able to do one injection, it reduces the inflammation at the time, and then you've got a continued progress, especially if, like you said, you can work to improve that horse's function. But if you're finding that your horse needs repeated cortisone, then I would, consider adding other things or doing other things. So one thing I would say is ideally with a cortisone injection, I recommend including hyaluronic acid, like intra-articular. If you don't do it intra-articular, then I would do a course of hyaluronic acid, like straight after the cortisone injections or before, which is once a week. They recommend once a week for 3 weeks. I've seen lots of good benefits of that on its own. So that's hyaluronic acid. There's some other options too, but they're just quite expensive, like IRAP, which is an interleukin-1 receptor antagonist protein, and that actually blocks that specific inflammatory protein. It's taken from the blood of the horse itself, and it supports regeneration and reduces inflammation. So it's recommended for chronic inflammation, so that's IRAP. But it's expensive, although there's no competition restriction. So for some of these, you're looking at like $800 to $1,000 for the injection. But I would say that's worth it than a cheaper, much. Cortisone is cheap, real cheap. But this is supporting the joints, and you won't have to do it as often, and you're actually looking after your horse's regenerative processes. Another option is PRP, which is platelet-rich plasma. I know like that sometimes they'll do that with the cortisone as well in people. And it depends if they're looking at more of a ligamentous damage, then that's more indicated, like for tendons and ligaments. But if we're looking at more specifically joint, then there's a product called ProStride, which also uses the horse's own blood, but extracts more than just the interleukin-1 receptor antagonist protein. So it extracts cytokines, growth factors, and anti-inflammatory agents. So it's quite like good at reducing inflammation and stimulating repair, and it can last up to a year. Arthramid is, I think, more recent. It's a polyacrylamide hydrogel, and so it's really giving, I guess, if you look at it like adding a sponge to the joint. And they say that the benefits can last up to 24 months. Like, I haven't specifically had clients who've had these yet, because they're really expensive. So you want to be seriously competing often to justify the expense of those. But at a minimum, I would say with the cortisone, inject hyaluronic acid either into that joint or, systemically to me is better because you're helping the whole body, supporting the whole body. But if you've got a really specific joint, then I'd do it with your cortisone into your joint. In terms of considerations with the joint injections, I mean, you touched on it there, but I think the welfare needs to be really addressed here. And, so if you're doing a cortisone injection, what other things would you recommend to support the horse?
A supported rehab plan, because, being able to, like we're just saying, capitalize on the comfort of that space and then take it forward and follow up so that you have a way of both identifying, understanding, and then changing your horses at the very base. It's their posture and their ability to use their whole body in a system that gives
Reduces
them,
load.
reduces load and creates a smooth and balanced movement. Can you hear my dogs in the background? No? Oh, that's positive. My microphone's doing its job there.
Yeah.
Yeah, so I mean, it's just the ability to have your horse have a smooth action. I mean, the way that the horse picks up and places their limb, the concussion, the twisting action and motion through the body. We've talked in episodes about the kind of motion being done, like a twisting motion, and puts torsion through the joint. It stresses all those the articular structures, the ligamentous structures, but also the soft tissue. So if you have, say, the stifle joint, you want it to be well supported by the muscle and the soft tissues and everything through that space. So without a rehab plan that allows you to improve the muscle balance, the function, the movement, the softness of the movement to decrease concussion, and to activate muscles so that they have an appropriate support with, limbs moving in all directions and in all ways. It's really just a key part of, getting the most out of your joint injections. But even if you're not doing, you're considering a rehab plan even without joint injections, seeing how far you get and how much improvement do you really get from the injection on top of a rehab plan.
Yeah, and as part of that rehab plan, like hoof balance is going to be so important, because you want to support that joint with making sure that the hoof pass and axis is aligned and that the hoof capsule itself is aligned. The medial lateral kind of balance of the joint. So, and you want to also decide, is this joint a result of a compensatory pattern? Like, do you have an old injury somewhere that set them up for this loading? So I had a horse years ago, that was part of her management. She had a really bad injury to her hock. It took us over 6 months of a very dedicated owner, to get her even back to being ridden. And it was an internal injury of the hock, so there was no external things. And we managed her for a couple of years at high level dressage, advanced level dressage, and every off season we'd basically be doing rehab. And she had regular HA, regular cartrophin, which we'll talk about. And then there became a point at which I said to the owner, I'm struggling to manage her now. Yeah. And so she went to the vet. They injected her hock and her opposite fetlock, which it obviously was decompensating from the hind end injury. It was the same hock that had the injury. And we got about maybe 3 weeks of improvement, which is not long. And at that point, I just said to the owner, like, well, this is not, she'd already been on all the joint supplements for that
Yes.
whole time. We'd done a lot of rehab and we'd struggled to manage her through that last little competitive season. And so, we had a discussion and she gave her away to somebody else who competed her at low levels and had her for the rest of her life. So, that's the really important thing that we need to consider there. And then I've had others where, we've given them injection. I had one recently and she'd done something, there was an injury to her stifle and they sent me the videos and anyway, it was obvious lameness. I sent them to the vet. They injected her stifle and then I gave the owner like strict rehab instructions. And she did end up with massive abscesses, but that was a little bit after. But we it hasn't been a problem since. So that was now 3-4 months ago. So that's what we want. Like we do an injection.
Yes.
And we gave her HA IV and they injected HA also into the joint with the cortisone. And I had another recent one where we've injected the hock. It didn't really make a difference. We've injected the stifle. It has made a difference, but now we want to look at long-term plans for her, like maybe some of the other options here, because the stifle is, as we've heard in the last episode, a complicated joint. And it's not a joint you want to keep injecting cortisone into because of its ligamentous structures like the cruciates and the meniscus. And so if you've got a stifle that's responded to joint injection, I'd be considering, arthromid or something like that to give that stifle the best chance of healing and a really good rehab program to support those surrounding muscles.
Yeah. So realistically, they're not so much an option to be, you're not basing your entire management plan on joint injections in terms of, that being a solution for comfort and performance.
No, and I'll just give an example of my dad because he's getting older and he's had a bad hip and he had his first, so he had an injection of cortisone and did I already tell this story?
Only to me.
Oh, that's okay.
You told me previously. No.
I told this story. Cortisone and PRP, I think he had, and so he's now had 3 lots of injections about 12 months apart. But in that interim, he's been going to a special gym. It's called the Kaiser Gym, and it's like really specialized for rehab and support. It's run by physios, and so he has specific exercises to work on his strength around that hip, and they're really tailored. He's not going to a gym where he's just lifting weights. It's like really specific exercises with really specific weights. And his doctor made the comment to him last time that he was like his biggest success because he was doing the exercises in between.
Yes.
And so if he hadn't have done that, he definitely would be at the stage of a hip replacement now because it would have continued to degenerate, continued to not be supported, continued to have suboptimal biomechanics. And as you get older, it gets harder. So yeah, that's what we need to be doing with horses, not using other things to support the cortisone so that we actually support healing and then doing an integrated thorough rehab plan.
Absolutely. And, just to add an example, my own mum has had a shoulder that's had a couple of cortisone injections, and her exercises on keeping the mobility in that space and also losing quite a significant amount of weight simply in itself. She said, like measuring the circumference of her arm because, she was curious. A lot of weight was lost and it's reduced the strain through that space. So, your loading, your pulling, your tension patterns all make a really big difference to,
Yeah,
just the
and
horse
weight
space.
is something we have to consider with horses too, like in terms of supporting the joints, because depending which discipline you're in, there are some disciplines where there's quite a lot of overweight horses. And we're still improving our recognition of that, but that can significantly overload joints. So that's definitely an important consideration with horses as well.
Yeah, absolutely. So
Yeah, so if they do get joint injections, we need to consider how we can do that in the best way. So as I said, always combine it with hyaluronic acid. But then there's a lot of oral joint supplements that are also available. So cartrophin or pentosan polysulfate is one, and that stimulates the production of hyaluronic acid, reduces inflammation in the synovium, um, and has been shown in shorter term studies to help decrease the fibrillations in cartilage, increase chondroitin, which is a cartilage building block, and stimulate hyaluronic acid and other kind of protein building things. But we don't really know the long-term effects of that. Like when it's being utilized on a monthly basis, the studies haven't been done on that. And a lot of the studies were also done on experimentally induced arthritis and just for a short period of time. Like they've shown a benefit within a few weeks, a month-ish, but not kind of ongoing effects of giving monthly injections.
absolutely. Yeah, they're definitely, and it'd be wonderful to see more long-term studies done on joint injections and seeing what the effects are in the long term and what changes there are, with and without rehab plans. That'll be an exciting space once that information is available and there's been more evidence to see what different integrated approaches are. And of course, with body workers and with you as a vet, you're often looking at the signs of improvement and what you see in the horse, but having that extra evidence and really, just having more information available, especially for other vets to use as well, to direct people towards rehab plans and supported plans so that they can get the most out of what they're doing, because you always, vets are always working towards the best outcome. So if it's available and the evidence shows it, that's going to be really useful.
Yeah. And the one thing I'd say with Pentazan is that, the Cartrophin Vet brand is the original brand, and that's the brand that I would recommend, specifically for horses. And also just to be aware of injection site reactions. Like I know Jelly, it wasn't with that brand, it was with another brand. He had an injection site reaction in his neck. And he has an underlying muscle condition, so I don't know how much of that influenced it. But the neck is a very complicated structure of muscles. And so when we're injecting in there on a monthly basis, we need to kind of be aware of effects we're having on the muscles. I also, there is also the rare side effect of things like an anaphylactic or a sudden death episode. I mean, that's the same with any kind of injections, but I'm aware of that happening. And so you just want to, always be aware of the risks with that. And I prefer regular IV hyaluronic acid, but obviously it's got to be given IV, and an ongoing oral joint supplement, so
Yes.
like Rosehip Vital, Formula 2, stuff like that.
Could you give just some context for why hyaluronic acid is so important for the joints, why you would be including it for intra-articular or IV injections?
Yeah, so hyaluronic acid is pretty much in every tissue in the body. Like it's important for fascia as well as, wrinkles, like use it on your face externally. But within the joints, the hyaluronic acid creates that viscosity of the joint fluid. And so that it's actually the joint fluid itself that like nourishes the joint structures, right? Like protects the cartilage, reduces that inflammation in the synovium. The synovium, which is the joint capsule lining produces that joint fluid, but if it's not healthy, then you have a reduction generally in hyaluronic acid. So you can basically look at it like giving it a boost. And so you give the joint the boost or the body that boost of hyaluronic acid, and it just adds the lubrication to the joints. And, you know, I'm jumping a little bit here, but in people, when they do injections for their skin, they aren't putting cortisone under our skin. I know this is different, it's not a pain thing, but they're injecting things like hyaluronic acid and PRP to like stimulate collagen production in our skin. And so hyaluronic acid is a building block for stuff like that.
Yeah, absolutely. And that's also, again, like motion is lotion. So,
Yeah.
talking about the synovium and it being able to nourish the body, there's also a bit of a pumping system when joints open and close, because nutrients are delivered to sort of just outside the joint. And what happens in there's like a pressure increase and decrease in the joint as it opens and closes. And so during that pressure change, that's when the transfer of nutrients come into the joint and waste leaves. So your horse, and one of the aims of these joint injections is to increase range of motion, because you've returned comfort to the joint. They get restricted and they don't open and close the joint as much. But we can do so much through rehab plans for bringing comfort back in to a joint, opening and closing them and continuing that motion, so that, manually, and also encouraging the kind of movement that they have. And all of those things, they're very accessible for you to do at home, as part of your horse's management. So there's lots of options and opportunities.
Yeah, definitely. So, I think the key takeaways are the joint injections can be a valuable tool, but they're not a cure. And that we need to look for the why behind, why we're injecting this particular joint, and take a step back and look at the entire body and the balance of that entire body, and the way that they're utilizing their biomechanics in that sense, and how can we optimize the posture and optimize the biomechanics to change and optimize the load on those joints. What would you say is a key takeaway?
Um, I just, I think that, yeah, functional, sustainable soundness is not the same as masking discomfort. And it's not really the topic of joint injections, but I really do believe that there's a lot that people can do at home, and when empowered, there's, a lot of room for improvement. And I wish everybody got to see what you get to see in the improvements, because you're always in that space, um, helping people with that. But the stories, or the changes that come, are incredible when you see them. It's,
Yeah,
really
yeah.
special.
Just by creating optimal posture and motion, we can really reduce our need for joint injections if we've, kind of addressed, um, the individual horse's function. So
Yeah.
awesome. Well, hopefully we've given you some food for thought, and some questions to raise, and that next time that your vet discusses a joint injection, you have some questions for them, and also you're going to, get support in developing a rehab plan in moving forward as well. So thank you for joining myself, Dr. Raquel Butler, and Sophie Vandenberg in today's podcast. Enjoy your horse time. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes, and give us a 5-star rating so we can share more valuable insights.
And we'll see you in the next exciting episode.